Medicine, to produce health, must examine disease. So, what is a disease? We invite you on a fascinating journey to think about this question. And a good place to start is to appreciate that defining disease is fraught with complexity. Disease definitions have and will continue to change with time and across cultures and social classes. And there are many issues and questions to consider. The word is derived from French and literally means to move away from ease. We need to appreciate the interconnectedness of biological processes within cells, tissues and organs in the human body. So a change in one will affect a change in another. The biomedical concept of disease is a mechanistic model which looks for underlying causes of disease. It regards the body as a machine with repairable or replaceable parts. So, can disease exist without illness? Does disease precede symptoms? And what is health? Is health merely the absence of disease? Can two individuals with the same blood pressure reading feel different? That is, can one feel well and the other feel unwell? We offer this for consideration, that disease is a consequence of the failure of homeostasis. Homeostasis is the concept of equilibrium or balance in the body, despite changes in the internal or external environment. Hence, disease is any condition of the body or mind that causes discomfort or dysfunction due to a loss in homeostasis. Disease can be physiological or psychological. Remembering that there is an interconnectedness within the human body and that intrinsic or external factors act on a cell, tissue or organ to produce structural or functional changes and a response. If adaptive responses are successful, homeostasis is maintained. However, if unsuccessful, disease manifests, impacting on cells, tissues and organs. Let's use lobar pneumonia as an example. In lobar pneumonia, the extrinsic cause is the bacterium streptococcus pneumoniae, which affects the lung. This stimulates an acute inflammatory response and in turn, reduced gas transfer in the alveoli. The structural and functional changes in the lung produce physical symptoms of cough, breathlessness and even hemoptysis, coughing up blood. The physician may detect the signs of reduced chest movements, an area that is dull to percussion, and X-ray opacity, reflecting lung solidification. However, this is not the end of the story. Another disease sequence is when the reduced gas transfer results in hypoxia, reduced oxygen saturation in the blood. This hypoxia acts as an internal factor which leads to tachycardia, an increased heart rate. More blood is pumped through the part of the lung which is not consolidated, which may successfully compensate by increasing gas transfer, thereby correcting hypoxia and producing a new equilibrium. Eventually, the infection may resolve spontaneously or after antibiotics, and the patient will return to the original state of equilibrium, or if overwhelmed by the infection, will die. It is the unique combination of these connections in any given situation that produces the final picture of health or disease. So we return to our statement at the beginning of this journey to reinforce that defining disease is difficult. We know there are infinitely complex pathways of cause, change and response that result in adaptation, or loss of homeostasis, health, or disease. We need to think about it like a road or metro map with many different paths and alternatives. It is the connections and networks rather than the individual processes that are important in determining the final outcome. Embrace and enjoy this amazing journey, the journey of wonder, excitement and diagnostic challenges. Welcome to the journey of discovering what is a disease.